Welcome everyone to the video on community assessment. Yes, we will try to understand a comprehensive community assessment and how to go ahead with it. So basically, first and foremost thing is what kind of problem is that you would like to address in a community. There are plentiful of problems in a community. Let's say gender violence, let's say poverty, let's say the spread of incommunicable diseases, widespread if I may say, uh, let's say basic neglect of education, or let's say some societal issue that prevails over a period of time. So these are the problems that you would like to address. So where these problems occur, you need to identify the spots which youth and families are most affected, what resources and strength your community has to have to address such problems, what are your things that is within your vicinity to address such problems thereby. So basic premises of community level challenges, change strategies, should I say community level change strategies. Changes are more likely to be successful and permanent when the people it affects are involving in initiating and promoting it. If you can uh, get to understand that the problem lies within you and you start eradicating it from within yourself, it becomes much more easier, smoother, and faster transition. So yes, we need to sensitize the community. Yes, we need to mobilize the community. Community organization mobilization is a planned process to activate a community to use its own social structures and any available resources to accomplish community goals, decidedly primarily by the community representative and consistent with the prevailing values. So working in community, there is a continuum of community work ranging from what might some might say as pure community development. The community decides the issue, the community decides the solution, and probably may ask an outsider, perhaps an expert advice thereby, to a more mixed method in which there is a combination of community and an expert input. No matter where the continuum our project falls, we must involve the community as much as possible, because this will, once the community becomes a stakeholder, na, your eradication of the problem becomes imminent. Listen to the community concern, respond to them, work with the community assessment to present this in the present scenario. Asset mapping, let us look into it. What every community would have some sort of an asset. These might be thought as located in a community under community control, located in a community under outside control, and located outside the community altogether. So something which you have within the community and within the control. Something which you have within the community, but perhaps the control is somewhere else. And there's something which is available outside and control is also outside, perhaps. Now let me address one at a time, right? So located in the community and community control. Let's say individual assets, skills, talent, experience of the residents, individual businesses, home-based enterprises, personal income, gifts of the labeled people, private and non-profit organization, higher education institution, hospitals, social service agencies, physical resources, vacant land, vacant structures, vacant housing, energy, and waste resources thereby. And how do we go across with it? Let us look at social assessment. Social assessment is the process of determining people's perception of their own requirements, own needs for quality of life, and their aspiration for the common goals through broad participation and the application of the multiple information gathering activities designed to expand understanding of the community. Required data from several sources, and should I say it requires the participation of the whole community member. So what are the objective indicators? This is very important for the quality of life, as in the unemployment rate, as in the school dropout rate, as in the levels of income, as in the violence that happens. Subjective assessment of quality of life is as important as the objective is all about it. It gives a view of the situation through the eyes of the community. Epidemiological assessment. What health problems are important? Which behavioral and environmental factors contributes to the health problem? The most common indicators, if there is something called mortality, what is the average lifespan, perhaps morbidity, what are the diseases that the community gets which is very much prone to, disability, discomfort, dissatisfaction, the expectation of life, expectancy, sorry, the lifespan, average lifespan, fitness, years of potential life loss, as the case might be. So, risk factor translated to diseases, disability, and death, collectively referred to as burden of diseases. Addressing risky behavior rather than the specific disease is a cost effective because one risk factor can result in or worsen several diseases. For example, tobacco causes or contributes to the lung cancer, ischemic heart diseases, diabetes, and cerebrovascular diseases thereby. Undernutrition is an underlying cause of disease, resulting in an estimate 60% of the child death. Cervical cancer, cervical cancer, and unsafe pregnancy, abortions and birth. Alcohol abuses contributes to the brain impairment, feeling fetal alcohol syndrome, cirrhosis, cancer of liver, and deaths and injuries from violence or accident perhaps. Now, health promotion, and how do we go across with it? On an individual scales, through knowledge, attitude, beliefs, and personality. On an interpersonal scales, it is through family, through friends, through peers. When we are talking about community, we are talking about social network, standard norms, talking about institutional, other rules and policies, informal structures, public policy, local policy related to health practices thereby. How do you conduct a community assessment? While the idea of conducting a community assessment may seem like a lot of work, it actually follows a straightforward process. This guides will walk you through the process that provides you with the tools to make it a little bit easier. Remember, this is not something that you should do alone or go alone. Building a community partnerships comes first and foremost above everything. Bring together people who have an interest in youth, will provide ongoing leadership, and will be the champions for this effort. These people may include your elected officials, faith and community leaders, local business owners, schools, law enforcement officials, volunteer organizations, agencies, media representatives, and most importantly, the families and youth themselves. Take advantage of the existing community resources and bring together people with different views, different experiences, and different skills altogether. Also, be aware of the people that are most successful in changing their lives only when they are truly ready to change. The same is true for communities. Take some time to determine whether your community is ready to take actions on behalf of young people. As you build your partnership and conduct an assessment, keep an eye for feedback you receive. There are many factors to determine readiness, such as the community support, the scope, the size of the problem, and the resources you have to draw on. As a result of your assessment, you may find that your community is ready to move ahead, or you may identify areas to work on before you can actually land your initiative for the youth thereby. So, there are basically 6 steps. First and foremost is establish what, where, and who. Second, learn more about what, where, and who. Third is to identify resources in your community. Fourth is to analyze and learn the data that you've collected. Fifth is to develop an action plan. And the last one is share what you have learned. That is very important. Once you have done this, once you have formed that community partnership, I'm talking about who, what, and where. Establish specific goals for your work. While we may wish to address some issues in every neighborhood, you will be most successful if you narrow your focuses to make sure all your partners are pulling in the same direction. Spend a quality time with what, where, and who of your project. As a part of a step, do not forget to talk to the youth for the first time. What are their concerns? Where do they need to do concentrate their efforts, or probably our efforts as a community partner interventionist? Once you have come to some consensus, you will have a much better idea of what data has to be collected and what needs to be done. This process doesn't always go as per plan. You may start out thinking of what you want to do something in one area, but as you learn, as you progress, as you gain knowledge, you may realize the root of the problem is completely lies everywhere, somewhere else. That's why it is important to collect data. That is why it is important. Remember, upfront and assess where and how you can be most productive. Otherwise, you may end up in wasting resources on something that isn't really a problem you thought it was, and that some other group is already addressing. Step number one: establish the what, where, and who. So, where do you start? Often the toughest question is what to focus on, even though it may be two specific events that brought you together. Many concerns, many issues are interconnected. Violence and substance abuse, for example, can go hand in hand. It can be very hard to separate some issues, but a partnership will need to narrow this focus, come to the crux of the problem. It is helpful to do some reading about your family, about the youth, about the community issues. Spend some time learning about the youth risk and the protective factor. These factors either increases young people's risk or for protect them from problems such as abuse, drug, or engaging in delinquent behavior. Later, it will be selected programs that have to be shown much more effective in addressing certain specific factors. It can be hard to measure the incidences of certain risks. For example, if you see you're concerned about the risk factor of a family violence, you may actually need to collect data on the number of protective orders written in your community. In research terms, we call these more concrete measures as indicators. Remember, indicators. Your coalition will want to identify indicator and potential data sources to measure those indicators. This activity will enable you to identify which risk or protective factors in your community may be influencing youth behavior. Below, you will find some example of common indicators that will actually ask you in answering certain issues as to what, where, who, and accordingly will plan strategies around them. Indicators of concerning your partnership, as in child abuse and neglect, youth violence, placement of children and youth in the foster family care, underage smoking, graduation rate, unemployment rate thereby. So where would you like to concentrate your effort? Is it in the city? It is in the town block? Is it in the neighborhood? Is it in the town, city, county, you name it. And now let us look who. Is there a specific population that you are focusing on? Let's say youth ages from 10 to 19 years old, low income families, single parent family, families with children, families with different education level, families with varying employment status. Come back to step number two. After you establish a specific goal of your work, you will need to gather as much information on the issues or population you are addressing. The first thing to do is to use online mapping. The online mapping tool will provide census data about your community, will help you to see where the people you are most likely to serve live in your community and show that your federal resources are available accordingly. Unfortunately, online mapping tool can't be providing you every information you will need about your community. Some of this will be coming from your own, and believe me, those researches that is coming from your own work will be the most beneficial one. Form a small working group, take on this job. Involve people who have expertise and experiences in data collection, perhaps someone from the college, university in your community, or from a local service agency. Remember, the others in your community may have already done it. Some data collection, look around and see what the results of surveys are focusing upon. Community forums or other data are already available. How has the information been summarized, club, made available to the public? What does the information tells you about the local problems, issues, and resources? Looking at this material may help you to assess how ready your community is to take the next step. If you have to start from the scratch, no work has been done. It is often easiest to begin by gathering data from available sources such as public records from your local health department, school district, chamber of commerce, police department. If you click on the risk and the protective factor list in the background section, it will help you give the indicators for each risk factor followed by some great example of where you might actually find those data. You may decide that you want to collect new data, absolutely new data through surveys, focus groups, and interviews because no single data can provide you a complete picture. Very true. Try to use more than one sources. Each report or pieces of information you review can provide you a different perspective. By drawing the multiple sources, you can look for areas of overlap and improve the accuracy of your assessment. Step number three, while you may have come to this tool because your community is facing some serious issues, you should never forget that there are many resources in your community that already exist can help you to address these challenges. Look for community organization, individuals who work on the problem you are interested in addressing. As you become aware of these resources, make every effort to include this group in your planning process thereby. It is often a good idea to involve youth. They often have the inside track of an organization, people who are most supportive of their needs and concerns. In some community, youth have undertaken a process called youth mapping, where they have developed their own maps of resources. As a second step, you should develop a community resource inventory thereby. A community resource inventory will help you identify and keep track of what? Of the services, the programs that exist in your community, of what? The financial resources of your community. of what the material resources your community has, the human resources your community has, the training, the technical abilities, the technical assistance that is required or probably available, and how to access these resources. Step number four, analyze, learn from your data that you have collected. Remember, this is the holy grail of community assessment. Spend some time analyzing the data so that you know how to proceed. It may be helpful to partner with local school district, hospitals, college, university, community planning agency to assist with this data analysis. These institutions often have trained staff who can analyze the information you have collected. When you analyze the data, decide which issues needs to be addressed together and which problem might have a different causes or lies beyond your current reach. When completed analysis will provide you a complete truer picture, current view of what are the issues, what are the indicators you would like to address in a community. Next, determine if the resources in a community are adequate or not to address the problem identified. Be aware that just not resources exist. They may not be adequate to achieve the outcome that you want. So here are the few questions that will help you organize your resources. What community problems can be identified based on data? What are the strengths of the community in addressing this problem? What geographic areas are most affected by these problems? How did the data compare with the initial perception perhaps? How did the data change your understanding of the problem? What are the underlying factors that contributed to the problems? These questions you need to keep on asking. What are the underlying factors that can help solve the problem? What additional data do you need to better understand the scope of the problem or understand the project that you wanted to undertake? The next step is the fifth step, developing the plan of action. After you've analyzed the data, develop the plan of action based on what have you learned. This plan should identify the issues that you want to address, the strategies you will use to tackle these problems, the coalition partners who can help in implementing the chosen strategy, the outcome you need to intend to achieve. Here are some good questions to help you guide your action. What target population do you want to serve? Which indicators are you trying to change? Which organization and programs are already in place serving the need for the population? How will your new programs fit with what it is already there? What do you need to implement these programs? Example, funding, training, technical assistance, and who can provide that support perhaps? How can you determine the success of your plan? In developing your plan, you can use the program tool. You can use the data you've collected on the indicators of the risk and protective factors concern you the most to help you select an appropriate program. It is not a good idea to go back to a community resource inventory to answer such question about how a new selected program will fit, which is already there perhaps. The last step is the sixth one. Share what have you learned. Planning, implementing, and sustaining a new community initiative next requires participation, requires support of the whole community. You have the best chances of success if there is a community involvement. The president and you need to understand such things to help people around. You may need to help your community members better understand the issues as to how they can be a part of the solution. Create a report of assessment, finding, recommendation, share it with the community by reaching out to your local media, holding community forums, advising elected officials and community leaders. Invite participation, invite input, invite feedback because this is only going to enrich your movement. So, share what you will learn before you develop a report. Before start typing the report, you should ask your partners what information should be included in the report. What is the best format for the report? Who should be leading the report? How do we want to disseminate the information? Should we hold public forums? Who will present at them? Which information should be presented? Who is the audience for the dissemination? Who from the large community needs to be involved in the dissemination perhaps. Let me give you an outline for the community assessment report before I wind up this video. We'll talk about introduction, we'll have a key findings, we'll take about the additional factor that needs to be associated, the strength, the resources, the action plan, the measures of success, the challenges that we have faced, and probably what are the challenges for the further studies. And last but not the least is your conclusion, your understanding of the problem, and how do you propose it can be much more refined and enacted. With this, I come to an end of this video. Thank you for watching it.